All right, guys, when it comes to what's going on in politics, we're going to hear from behind the scenes details that we haven't heard yet in regards to the American Rescue Plan and the American Family Stimulus Plan. We're going to talk about that in detail here on Mostly Money. As I mentioned before, what they plan to do with both bills, they have no plans on passing one bill without passing the other.
This really is a pivotal moment in American history. Through the reconciliation bill, what we are doing is taking on virtually every powerful special interest in this country. And I'm talking about the drug companies and the insurance companies, and the fossil fuel industry, and corporate America, and the wealthiest people in this country. Because what we are trying to do, among many other things, is lower the cost of prescription drugs in America. Because the American people are sick and tired, in some instances, of paying 10 times more for the same exact drug sold in Canada or in Europe. And what the pharmaceutical industry has done year after year for huge amounts of money in lobbying, the campaign contributions. In fact, they have spent over $4 billion in lobbying and campaign contributions in the last 10 years. So that the result is that they can raise their prices to any level they want. They can double the price of the drug you're getting tomorrow, and that's legal because they write the laws. And today, 1 out of 5 Americans cannot afford the medicine they need. How outrageous is that? How outrageous is it that thousands of people literally die each year because they don't get the insulin, they don't get the medicine that they desperately need, but they can't afford it? Well, we are now taking on the pharmaceutical industry. At the very least, what we want to do is have Medicare negotiate prescription drug prices with the pharmaceutical industry, raise many, many hundreds of billions of dollars, use that money to expand Medicare to cover dental care, eyeglasses, and hearing aids. And the pharmaceutical industry is doing everything they can. They're putting dishonest ads on television. They're lobbying like crazy. But now is the time, finally, for the Congress of the United States to have the courage to stand up to the drug companies, to stand up to the fossil fuel industry, to stand up to the healthcare industry, and represent ordinary Americans and not just the wealthy and the powerful.
Senator Jayapal is one of the most important congresswomen in the House of Representatives, and she is giving details behind the scenes.
Let's talk about your hesitation about this bill. Has it got anything to do with what's in this bill? Because we don't really know enough about what's in the bipartisan bill, or is it all about not trimming stuff off of the other bill that you are more?
Well, as I said in my statement, we don't know what's in the bipartisan bill. So we have to see it. We have to make sure that we agree with the provisions that are in the bipartisan bill. And we have to make sure that the reconciliation bill is passed before we will vote on a bipartisan deal. This is something we've said for 3 months, and it's not just progressives. House Speaker Nancy Pelosi has said the same thing. Chuck Schumer has said the same thing. The reality is these two bills have to move together because the core of what Jared Bernstein was just talking about with you is that we need to make significant investments in the health and well-being of the American people. Coming out of the COVID times, but even before that, Allie, we had a situation where the wealthiest and the rich do just great in America, but everybody else does not see the opportunity for them to advance in their generation. Not just their generation, not just 2 generations, but in 3 generations, people don't see economic growth. So that's why the reconciliation plan is so important, with investments in housing and free community college, in childcare, in paid leave, in Medicare expansion, and of course, in saving the planet and protecting immigrants who have been at the forefront of protecting us during COVID.
So let's talk about, we don't know what's in the bipartisan bill. Obviously, the much larger reconciliation bill, we have fewer details. I heard you say you want to see that reconciliation bill done before. Do you mean literally before, or do you mean in conjunction with, or approximately at the same?
No, we really need to see the reconciliation bill passed in the Senate before we can advance the bipartisan deal. And the reason is because it is very important that all 50 Democrats, including those who negotiated the bipartisan deal, understand that this is a twofer. You kill one, and I remember Joe Manchin saying this a week or 2 ago about the bipartisan deal. He was saying, if you kill the bipartisan deal, then the whole thing is off. Well, we got a message, too, which is you kill or undermine the $3.5 trillion reconciliation package, the whole thing is going to collapse. So it is really important that we do these two things together. I believe we can do it, Ali. I just want to be clear. I really believe that we can get there. There is a tremendous amount of agreement, most importantly from the American people. Republicans, Democrats, and independents support this kind of investment because you know why? So many people are suffering across the country, and they want us to desperately and urgently address the needs that they are facing.
Now, the first thing that she said was, hey, they've got a long way to go when it comes to agreeing on the bipartisanship bill. She said they haven't even seen the bill. It may take a couple weeks for the Democrats to agree on everything that's going to go into this stimulus bill. The second thing that she mentioned is this. Since the details don't exist yet, she's saying we're not going to just jump the gun and say, yes, we're going to agree with it before we see all the details of what's going to be in it. And lastly, she's already said they are not going to pass or agree up on the American Rescue Plan unless the reconciliation that the Democrats are putting together in regards to the American Family Plan, which is $3.5 trillion, is agreed upon completely.
Hey, let me buckle you in though, okay?
90-year-old Ray Newbaker struggles with dementia and a broken hip. Her children, Paula and Jay, are her round-the-clock caregivers.
Do you like your home? Oh, yes.
But it's not easy, taking care of her personal needs, managing her finances and doctor's visits, along with her worsening dementia. It's emotionally, physically, and financially exhausting.
Is this hard on you? It's the hardest thing I've ever done in my entire life.
A growing number of aging Americans would prefer to stay at home. Because Medicare doesn't provide for long-term home health care, and Medicaid assists mostly low-income patients, and waivers often come with long wait lists, in their twilight years, many fall through the cracks.
I call it the twilight zone, where we make too much for Medicaid, and yet we don't make enough where we can afford 24/7 high-quality care for my mother. So we're stuck, paying for her care out of our own pocket. And while we're more than happy that we're able to do it, it's really not sustainable.
In the Democrats' human infrastructure bill, they want to increase the number of people eligible to receive home-based care through Medicaid by raising the income cap to 3 times the poverty level, or an income of about $38,000 per year. It would provide financial help to an estimated 3.2 million elderly and disabled.
Many people in this country are going to spend down their entire life savings caring for parents, caring for children. We can do better than that. We know how fundamental this is, and we have to stop relying on our safety net being the low-paid or unpaid work of women.
40 million home health care workers are some of the lowest paid in the country. Jody has been taking care of the elderly for 25 years.
There's people out there that are working at McDonald's that are making more money than me, and that's really not fair.
Have you ever thought about leaving this job because of the wage?
Absolutely.
Along with aiding the elderly, Democrats' proposal would help people like Jody, too, by requiring they're paid a living wage. The two parts of the proposal come with a high price tag, up to $300 billion.
And people say it's expensive, and I'd say, yep, it is expensive. It's about time we started to invest in families.
Despite the cost, Democrats are confident that their elder plan is popular. According to internal polling obtained by NBC News, likely Democratic voters strongly support expanding access to elder care and paying home health care workers more money. As for Republicans, well, I asked Senate Republicans, and they said they might perhaps be open to a conversation about expanding home-based health care for the elderly, but they say they will not support it in this massive $3.5 trillion human infrastructure bill. They call it a reckless tax and spending spree. Allison.
That reconciliation bill, which is the American Family Plan, has all the things that President Biden has been wanting, the things that Bernie Sanders has been talking about as far as Social Security, as well as the elderly, as well as hearing, dental, and vision is concerned, as well as other programs for families. Stimulus payments can be added off in here in the American Family Plan. So this is the larger one that they are focusing on reconciliation on. And they're saying we are not going to vote and pass this bill, which we don't know what's all in it, until we pass our own bill without Republican assistance, and they're going to be able to put into that $3.5 trillion bill and putting in there things that will benefit American citizens. And I'm here to give you all facts. No fake, no phony, and no fluffed up information when it comes to what's going on in politics. Thank you guys also for subscribing, clicking the notification bell, as well as making sure that you click the like button.